Even with nutrients as well known and widely recommended as omega-3 fatty acids, it's important to begin with the cautions because concentrated EPA/DHA capsules behave differently from eating fish once or twice a week. High-dose fish oil supplements can sometimes cause mild digestive upset, interact with blood-thinning medications, or slightly raise LDL cholesterol in a small subset of individuals. People with seafood allergies must be especially careful, and anyone with bleeding disorders should speak with a clinician before starting higher doses. Quality also matters. Poorly purified oils may oxidize or contain contaminants that undermine their beneficial effects. These warnings are straightforward to manage, and once addressed, the much larger and more hopeful story about omega-3s becomes clear. This study brings fresh insight by comparing EPA/DHA supplementation directly with low-fat dietary approaches, an important contrast because for decades, low-fat was viewed as the default prescription for heart health. Instead, the findings show that targeted omega-3s produced significantly greater reductions in vascular inflammation markers, particularly high-sensitivity C-reactive protein and IL-1 beta. These molecules are not surface-level indicators. They represent deep, systemic inflammation inside blood vessels, the kind that contributes to plaque instability, endothelial dysfunction, and long-term cardiovascular risk. Seeing these markers drop more sharply with omega-3 capsules than with a generalized low-fat diet suggests that the body responds better to the quality of fats rather than simply reducing them. The reductions in hsCRP are especially promising. hsCRP is one of the strongest predictors of cardiovascular events, sometimes outperforming cholesterol levels in identifying risk. When this marker falls, it signals that the inflammatory processes inside arteries are calming down. That improvement reflects smoother endothelial function, more stable plaque behavior, and a lower tendency for the vascular system to experience oxidative stress. For midlife and older adults, this represents a meaningful shift toward better heart resilience, not just better lab numbers. The drop in IL-1 beta adds another powerful layer. IL-1 beta is a central coordinator of inflammatory signaling that contributes directly to arterial stiffness, insulin resistance, and the slow vascular aging that progresses quietly over decades. Efforts to reduce IL-1 beta pharmacologically often involve very expensive or aggressive medications used only for high-risk patients. The fact that EPA/DHA, natural, widely accessible fatty acids, can reduce this pro-inflammatory cytokine suggests that omega-3s are working on a deeper regulatory level, calming the internal inflammatory switchboard that drives cardiovascular decline. This is more than a nutritional benefit, it's a strategic shift in the body's inflammatory trajectory. A compelling aspect of this research is how well these improvements align with what scientists understand about omega-3 physiology. EPA is known to generate specialized lipid mediators, resolvins and protectins, that actively turn off inflammation rather than merely block it. These molecules help the body resolve inflammatory episodes cleanly, preventing lingering low-grade inflammation that damages arteries and accelerates aging. DHA, on the other hand, supports membrane fluidity in vascular cells and improves endothelial responses to stress. When EPA and DHA work together, they create a nutritional environment that supports healthier arteries at a fundamental level. Compared with the low-fat diet group, which often saw modest or inconsistent reductions in inflammation, the omega-3 group achieved more robust improvements without the need for strict dietary restriction. This is encouraging for real-world use. Many people struggle to maintain low-fat diets long-term, and in some cases such diets can unintentionally increase refined carbohydrates, leading to higher triglycerides and more inflammation. Omega-3 supplementation provides a simpler, steadier approach, one that doesn't rely on constant meal planning, caloric vigilance, or restrictive eating patterns. The heart health implications extend beyond inflammation markers. Better endothelial function improves blood flow, reduces arterial stiffness, and enhances nitric oxide signaling, all essential for maintaining circulation as people age. Many participants report subjective benefits as well: smoother energy, fewer inflammatory aches, and a general sense of cardiovascular ease. While these experiences are not the core of the study, they match the physiological improvements observed. What makes this intervention especially hopeful is its accessibility. EPA/DHA capsules do not require major lifestyle upheaval, They supplement and support the body's existing regulatory systems. And unlike some heart health strategies that only reduce risk, omega-3s actively build resilience, strengthening the body's ability to respond to stress, repair tissues, and maintain vascular flexibility over time. This quality makes them ideal for individuals in midlife and older adulthood who want sustainable, gentle, and evidence-based support for long-term cardiovascular protection. Altogether, the study offers a clear and uplifting message. Omega-3 fatty acids, when taken consistently in well-purified EPA/DHA form, can reduce vascular inflammation more effectively than traditional low-fat diets. By lowering hsCRP and IL-1 beta, supporting endothelial health, and offering a direct biological pathway toward cleaner, calmer arteries, omega-3s stand out as one of the most promising, natural tools for heart protection. With mindful dosing, good product quality, and a balanced lifestyle, they become a steady ally in maintaining cardiovascular vitality as the years progress.